I'm David Lombardo, and this is WCNY's The Capitol Press Room. And with May being Mental Health Awareness Month, we're joined in the studio by State Mental Health Commissioner Ann Sullivan. Welcome back to the show, Commissioner.
Thank you. Pleasure to be here.
It's our pleasure. So I want to start by talking about the availability of mental health services in New York and how you think maybe the landscape looks compared to when you became mental health commissioner about 12 years ago now. For example, is the picture demonstrably different? And if it is, are there any particular bright spots that you would point to and say, we've made a lot of improvements in XYZ area?
Yeah, I think it's incredibly different, actually. And I think that the investment of this governor has also had a tremendous impact. It's in a couple of key areas. One is prevention. We're doing so much more in prevention in terms of work in our schools, suicide prevention, mental health first aid in our schools. We're doing tremendous work with pediatricians on healthy steps in prevention. And prevention was never highlighted that much in mental health, but it's critical. It's really critical. And then access to care, it's an incredible increase. We had, several years ago, we had about 13 what we call certified community behavioral health centers. Now we have 39. That's serving about another 100,000 New Yorkers totally, which is incredible. We've expanded our intensive services. We've doubled our home-based crisis intervention services for kids. We've increased Youth Act, something we never had before. Youth Assertive Community Treatment, which is specialized intensive services for kids. We didn't have that 10 years ago. We've had it for the past 3 or 4 years. Helps kids get out of emergency rooms, helps families with intensive problems get the help they need in the community rather than be in hospitals. And we've greatly expanded ACT teams, those similar teams for adults. We now have over 10,000 assertive community treatment slots across New York State. That's the highest anywhere in the nation. We've expanded housing dramatically. We have 51,000 supportive housing units in New York State. So when you talk about access to care, I think it has significantly increased over the past decade, but especially with the $2 billion investment from this governor. We've been able to increase it.
Well, how do you think that has compared to the demand for these services? Because you've also been commissioner during a period where there's been a lot of chatter about the increased need for services as well, whether it's the pandemic or the mental health concerns that are arisen out of, say, the social media and kids being online. Do you feel like they've been able to keep up with that? And do you feel like you've had to evolve on the fly to the demands that have been presented in the last decade?
Well, there's more demands, but the services depends. There's certain areas still which we don't have everything that we need. But if you take, for example, inpatient beds, post the pandemic, we were at a very high occupancy in our beds. And now with the 1,000 beds that have been added since the pandemic and both reopened and added, we're now at about what they call 85% occupancy, which is a great occupancy for inpatient beds. That means that beds are pretty much available. It doesn't mean that there might be one particular time when it's a little difficult, but beds are generally available. And similarly, the CCBHCs, which we've been expanding, are open to all comers, and they have to take anyone who walks in the door. And they're funded to do that. So that's tremendous. So you can get that help. That doesn't mean that everybody's still getting everything they need. Another big change, which we're monitoring very closely, is legislation that was passed 2 years ago, actually, which was effective as of July of last year, that you could get a mental health appointment in 10 days from your insurer. Now, we're watching this very closely. And some insurers, we've been doing what do you call that, secret shopper? We've been doing that, and some insurers are really sticking to it, and others aren't there yet. So we have to monitor that. But there's no reason that insurers, let me just say this, can't get you a mental health appointment in 10 days. So the reality is that by putting that into legislation and now monitoring it, we're hopeful, given a little more time for everybody to get used to it. But when clients come to us and say they couldn't get it, then we work with those insurance companies to make sure it happens. So a lot of work's being done on access. It's still not perfect. And certain areas, it's still harder. Rural areas are still a challenge for sure. And also in some of our underserved areas and communities in the cities, largely because people, it's hard for them to be open about coming forward with mental health problems. So they tend not to access even maybe what's there. And we need to do better work with that.
Well, I want to follow up on that idea of getting people in the door? Because it is one thing to start that process, but to ensure that continuum of care can be a challenge for a variety of reasons, whether it's because there are gaps in the service or whether a person's life just interrupts the ability to ensure that continuum of care. So what are you doing to ensure that someone doesn't fall through the cracks and that they are going from point A to hopefully whatever Z looks like?
Yeah, I think, it depends. I think for some individuals, they can come in for services and it's not for that long. I mean, they get the help that they need and they can come back again if they need it. But then some individuals, they need more intensive help. And for that, we have put together a number of supportive teams that work with those individuals and help them navigate services, but also help them recognize the importance of staying in services. So we have specialized teams that work with hospital discharges, which we're putting up, individuals leaving emergency rooms, some of our homeless on the streets who are unsheltered and who have traditionally kind of avoided us, haven't trusted us for services. We've had a lot of success with specialized teams that work with them, help them get into housing, and then stay with them through all the transitions that happen in terms of getting housing, beginning to get involved in community services, etc. So it's not perfect yet, but I think we're getting much, much better and much stronger at the ability to help people stay within the system and get the services that they need.
Well, I want to follow up on that reference to the homeless, but first let me reintroduce you for listeners just joining us. I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're speaking with State Mental Health Commissioner Ann Sullivan. So in terms of giving and delivering mental health services to the homeless, that's been a part of the conversation here in Albany in recent years, and it's been the subject of legislation. Where do you think we are in that broader scheme? Can you expand a little bit on what we're doing to connect people to those services and then follow up to make sure it's not just maybe a brief interim stay somewhere, but that there actually are maybe some sort of pathways for those people?
Yeah, this is a certain group of individuals who've often been on the streets or subways in New York City or under bridges upstate sometimes for many years, sometimes for decades.
Parking garages in Saratoga Springs.
Yeah. And how do you approach them? Well, what we've learned is that if you have people who really connect with them, who will work with them over time, engage with them, we've been able to house in the city over 1,000 individuals who previously have been unsheltered for many, many years. And upstate and rest of state, Long Island upstate, over another 700 individuals. And when they get into housing, it's something called Housing First, which means that we cut through the red tape. They can get into housing when they tell us they're ready. And then when they get into housing, they get lots of supports. And then these teams stay with them for as long as it takes for them to adjust to housing and to adjust to services if they accept them. They don't even have to accept the services. They can just accept the housing, but most of them work with us once we get the housing and they're there and they begin to trust us. We've had 90% retention in that housing. People have stayed in the housing. And these are individuals who were on the streets for many years. And the investment in this by the governor has been tremendous. And it works. It works. So it's a matter of just continuing to grow that so that we can help more and more individuals get the help that they need. But it works for individuals.
Well, sticking with that idea of these evidence-based solutions that you've identified, but where there's clearly room to grow, how do you go about trying to expand your capacity in certain areas? Is it about going to the Division of Budget and saying, hey, this is a good investment, saves you money in the long run? Do you got to knock on the second floor door for the governor? Well, what do you do to help follow through on those?
Yeah, I think, the governor and the administrator, they've been excited about this work. So, for example, we began in New York City. We had about 15 to 20 teams in New York City. And then we said, well, the rest of the state, needs this service too. And so money was put in the budget and a subsequent budgets for us to expand the same work that we were doing in New York City and downstate, upstate. So, and then as the need grows, we go back and we talk about whether we need more. Right now, we're doing a fair amount of work. We're seeing how the flow is. We're trying to get the data on the number of homeless that are still there. We think it's coming down, because we're housing people. But then when we get more data, we'll know what we may need to expand, and then we'll talk about that and discuss that. But there has been a definite support of this because we expanded significantly from New York City to the rest of the state.
What about the future? What about the next 12 years of State Mental Health Commissioner Ann Sullivan's career. Have you thought about what that looks like? I mean, there are obviously certain things that are part of the long-term planning already, like implementing the legal settlement to ensure those kids on Medicaid are getting local services. But have you thought big picture about what the next 12 years in this space look like as you try to stay ahead of the curve or try to gauge the capacity that's needed for different services and demands?
Yeah, I think there's two areas. One, I think, is what I talked about earlier, which is prevention.
Mm-hmm.
If in this budget, if it passes, that we get the dollars to be able to really do mental health first aid for all sophomores in high school, just think about that for a minute. That's kind of a game changer in terms of a generational understanding and education of mental health. And the stigma that's still associated with mental health, the fact that people are reluctant sometimes to go for help for mental health issues. If you can start to change that at that age and begin to grow generations, I think, of individuals who see mental health issues so differently, I think that's tremendous. So I think that's one thing, to keep moving those generations so there's a different acceptance. And then for individuals who have serious mental illness, I think the big move here is to help individuals thrive in the community. Not just live in the community, but thrive. And that means employment opportunities. That means all the work that has to go into, and we're doing a lot of this, but I think that could grow. I think that's some area that we're continuing to work with, because individuals with serious mental illness want to work. They want to do things. They want to volunteer. They want to be parts of communities. And we need to get communities to accept that, get rid of the stigma.
Yeah, I was about to say, there seems like there's going to be local stigma that you have to overcome.
Yeah, the housing, we still, sadly, have trouble sometimes citing housing or citing our crisis stabilization centers because communities are worried. They're afraid. But once we do it, they're always accepting and they love it. But it's hard to get there. So get rid of that stigma and help communities embrace their neighbors and bring people in. So I think that's where we would like the future to go. And that includes things like housing, really strong services and support services, and helping individuals live full lives going forward.
And I noticed you didn't reject the idea that this is going to be the start of another 12 years of your tenure. So safe to assume you're looking to stay on past 2038?
That's a long time, guys. That's a long time.
Well,
but I love this work, so I'll stay a while.
Well, we've been speaking with State Mental Health Commissioner Ann Sullivan. Commissioner, thank you so much, as always, for making the time.
Thank you. Thank you.
Support for the Capitol Press Room comes from O'Donnell & Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com.